Hello students, welcome to this session Hematology basic requirement. So now first, what is hematology? Hematology is study of blood. Hem is blood and logy is study. So today we are going to study what are the things required to start the hematology laboratory and investigations.
Hello students, today we are going to study blood composition and functions. So definition of blood. Blood is a liquid connective tissue in which intercellular substance called plasma and cells like RBC, WBC and platelets are suspended. The physical characteristics of blood. So blood is red in color, pH is slightly alkaline, that is 7.2, specific gravity is 1.055 to 1.060. Blood volume in adult human body is roughly 5 liters and viscosity 5 times more than the water. So this is viscous because of the cells present in blood, that is WBC, RBC and platelets. So composition of blood, it is mainly of two things. The liquid portion is called as plasma and the solid portion is called as cells. So cells are of three types: RBC, platelets and WBC. So red blood corpuscles, platelets also called as so RBC also called as erythrocytes, platelets are also called as thrombocytes, and white blood cells also called as leukocytes. Again, white blood cells are divided into two types according to the presence of granules in the cytoplasm. So if granules are absent, they are called as agranulocytes, and they are of two types, lymphocytes and monocytes. And if granules are present, they are called as granulocytes, and according to the color of the granules we can differentiate these cells. So pink color granules seen in neutrophils, orange color granules seen in eosinophils, and dark bluish color granules seen in basophils. Then plasma. So liquid portion is called as plasma, and it mainly contains water, 80 to 90% water, and then biochemical substances like organic and inorganic. So organic like glucose, fatty acid, amino acid, proteins. So these are all organic compounds, and inorganic like sodium, potassium, chloride, calcium, phosphorus, iodine, iron, magnesium. So these are all inorganic compounds. So these form the biochemicals which are present in plasma. Now we will see functions of blood. So main function of blood is nutritive in nature. So it is blood supplies glucose, amino acids, vitamins from the digestive system to all over the parts of the body through the blood. Then excretory function. So it excretes urea, uric acid and unwanted substances and water from the kidney. So it is excretory function. And the main function is respiratory function. So blood carries oxygen from lungs to tissues and carbon dioxide from tissues to lungs by hemoglobin. So hemoglobin combines with oxygen, forms oxyhemoglobin, and then it gives oxygenation to the tissues. And carboxyhemoglobin by combination of hemoglobin and carbon dioxide, and then it is going to lungs and then it is exhaled outside in the environment. Then defense function by WBCs, then acid base balance, regulation of body temperature, maintenance of viscosity, then water balance. Clotting of blood is because of the platelets, maintain colloid pressure and hormone transport. So the hormones produced by endocrine glands like thyroid gland produces T3, T4 and other hormones. So these are transported to all over the body through blood, and then the homeostasis, that is balance is maintained.
Hello students, welcome to this session. So today we are going to study about blood collection procedures. So they are venous, capillary and arterial. So we will see all these in detail.
Hello students, today we will have blood collection procedure lecture. So blood collections are of three types: venous, capillary and arterial. So first we will see things required for blood collection. So what should be there in your blood collection kit? So there should be syringes of different sizes like 2 ml, 5 ml, 10 ml, needle of different sizes like 24, 22, 21 and 20 number, spirit, cotton swab, bulbs like EDTA for CVC, plain for all biochemistry and serology, fluoride for blood sugar level, citrate bulb for blood coagulation testings. tourniquet and sticking for the vein to become prominent, and then for the last sticking for the pressure. So first is sight. So it is median cephalic vein of the forearm, or the whichever palpable, visible, prominent vein we can select of the arm, forearm, or from any wrist. Then select the vein and then clean it with spirit swab, and then apply tourniquet to make the vein prominent, and ask the patient to close the fist so that vein will become prominent, visible, and then with left hand steady the vein, and then put needle into the skin and then puncture the vein, and then collect the blood. Plunger is pulled back gently when blood starts flowing into the syringe. Then remove tourniquet, collect adequate amount of the blood, and then ask the patient to open the fist, and then remove needle, syringe, put pressure with spirit swab at the puncture site, and then put your collected blood into the appropriate container. Then you have to put pressure for 10 to 15 minutes to avoid the complication like hematoma. Hematoma is the seepage of blood in the subcutaneous tissue. So uses of venous blood. So all hematological investigations. So preferably venous blood we require mainly for the very large quantity of blood is required. So like hematological investigations like ESR, PCV and other cell counts. Biochemical investigations where the serum is required. Serological investigations where the serum is required, and for blood culture. So second method for blood collection is capillary method. It is also called as prick method or skin puncture method. So site in mainly adults it is ball of the left ring finger or lobe of the ear. In infants it is ball of the thumb, great toe or heel. Procedure: so first you have to clean the part with the spirit swab, and then you have to take lancet or needle and then prick that area with help of lancet or needle, and then first few drops you have to wipe out because it contains tissue fluid, and then remaining blood is collected and then investigations done. So here you can see this third method. It is arterial blood collection method. So in that radial artery is preferred, and then that is felt with 3 fingers at the radial side of the wrist joint below thumb, and then where the radius bone is there, then clean that area and then puncture the needle, puncture the site with needle attached to syringe, and then blood will come into the syringe, and then adequate quantity of the blood is withdrawn, and then apply pressure for 10 to 15 minutes with spirit swab. Uses of arterial blood: so usually it is required for blood gas analysis, and then it is done in patients of ICU patients. And uses of capillary blood: it is bleeding time, clotting time, hemoglobin, blood grouping, malarial parasite, total WBC count, differential count, RBC platelet retic count, peripheral blood smear report. So mainly capillary blood is required where the less quantity of blood is there. Thank you. Thank you.
Hello students, today we are going to study about anticoagulants. So they are EDTA, heparin, citrate, fluoride. So we will see them in detail.
So today we will see lecture on anticoagulant. So definition: anticoagulants are chemical substances which required to prevent clotting of the blood when it is mixed with the blood in proper proportion. So in short we will see clotting mechanism. So when there is an injury to the vessel, so in first step the thromboplastin is released, and then that is activated. Then in second step it activates prothrombin into thrombin, and then it activates the fibrinogen into fibrin monomer, and then all fibrin monomer combine to form fibrin polymer, in which all the WBCs, platelets get entangled, and then it forms the clot, and then it covers that injury area, and so that bleeding stops. Now we will see a few examples of anticoagulants. So first is ideal anticoagulant used in hematology. It is EDTA, ethylene diamine tetraacetic acid. So mechanism mainly it is calcium chelating agent. So it removes calcium, and so that there is no clotting, and then blood is in liquid state. So uses of is all hematological investigations like HB, CBC, ESR, PCV, and all cell counts. Second is trisodium citrate. It is 3.8 to 3.2%. Mechanism mainly it converts ionized calcium into unionized, and because of that then they are not available for the blood clotting. Uses mainly by ESR by Wesegreen method and prothrombin time or blood coagulation tests like PT, PTT, APTT, etc. Third is sodium fluoride. So mechanism mainly it is prevent glycolysis of the sugar in the blood, and because of that the blood sugar level is maintained, because it prevents action of enzymes glucose oxidase, and uses is blood sugar level. Other anticoagulants, first is heparin. Action is antithrombin and use mainly it is for the blood gas analysis. Next is blood that is double oxalate. It is ammonium oxalate plus potassium oxalate, and then uses are like EDTA. Potassium oxalate it is mainly used for the blood urea level. Plain bulb where the no anticoagulant is added, and it is mainly required for the serum preparation, which is required for the biochemical and serological investigations. Anticoagulants used in blood bank. So first it was ACD, that is acid citrate dextrose. Then it was CPD, that is citrate phosphate dextrose, and now it is used is CPDA, that is citrate phosphate dextrose adenine, or sometimes SAGM, that is saline adenine glucose mannitol. So we'll see functions of each component. So citrate it acts as a anticoagulant, phosphate it acts as a buffer, dextrose it gives nourishment to the RBCs to be kept for more days, and mannitol it is a membrane RBC membrane stabilizing agent. So ACD blood can be stored up to 21 days, CPD blood can be stored up to 30 days, CPDA blood can be stored up to 35 days, and SAGM blood can be stored up to 42 days, and this SAGM mainly used in a high setup blood banks. Hello students, today we will talk liquid portion separated from blood after clotting. So in that anticoagulant is not added, and because of that clotting mechanism takes place. Plasma is liquid portion separated without anticoagulant, and therefore clotting mechanism doesn't take place. So clotting factors are not present in serum, but clotting factors are present in plasma. Serum is used for preparation mainly for the investigations of biochemistry or serology, and then in that plain bulb you have to use for collection of the blood. Plasma is used mainly for the blood coagulation test like PT, PTT, APTT, or blood sugar test like fluoride bulb is used, and for blood coagulation test citrate bulb is used. Thank you.
Hope you find this session useful for your understanding and for your exams. Thank you.